Good morning. It's still the morning show. Good morning, Abuja. Welcome back from that very short break. And yes, the show is still on, and we are having an amazing time in this brand new year 2024. This morning, we want to look at the water and sanitation situation of our dear country, Nigeria, particularly here, Abuja. And you know what they say, water is life. And a clean environment is an environment that we can seek God's face in. And this new year, there is no better way to kickstart it than to look up to God and pray to God, and He will do it for us, put us on a path of economic prosperity. But a clean environment is required for us to be able to do this. That's why this morning we have in our studio the executive director of Rural Water Supply and Sanitation Agency. I'm talking about Dr. Mohammed DAN-HASSAN. Good morning. You're welcome on the show.
Thank you for having me. It's a
Yes,
pleasure.
sir.
Happy New Year, sir.
Thank you. Thank you.
Yes. Um, it's the year 2024, so permit me to say Happy New Year.
Thank you. Same to you.
Yes.
All the best.
Nigeria is a very unique country, a country that is so blessed. And yet, it seems like in the midst of these blessings, there are certain things that we still lack. One of this is potable drinking water. Let's look at, from your perspective, just give us an analysis of the rural water situation and the sanitation challenges.
Thank you very much for this great opportunity.
Yes, sir.
We kickstart the year 2024 with a vision and mandate to really improve access in our rural water supply and sanitation services. As we are aware, Nigeria, we have challenges in terms of provision of safe drinking water, especially in our rural communities. Even the urban centers are not left out. If you look at the statistics from the WASHNOM, Water, Sanitation and Hygiene Routine Mapping Survey,
Okay.
released by the Federal Ministry of Water, Resources and Sanitation, and analyzed by Bureau of Statistics. In terms of like sanitation, Nigeria, we have 23% of the population practicing open defecation,
Wow.
which gives us about 48 million Nigerians defecating in the open. And that really impinges on the aspect of sanitation. And in terms of the rural water supply, it varies across the states, across the geopolitical zones. If we come down to, say, FCT, for example, we have 30% of the population of the FCT, which is about 1.8 million residents of the FCT practicing open defecation.
Wow.
That means they defecate in the open.
Yes.
And as long as we have one person defecating in the open, we are not safe because of the germs, viruses, and bacteria that are in that human waste. And when you look at also the water supply situation in the FCT, in the satellite towns and the city center, you have about 70% coverage. But however, in the rural communities, we have 60 to 65% coverage in terms of safe drinking water. So the challenges are high, and we have mapped out strategies and actions to tackle this. In the last 3 years, we've made some provisions. For example, in the year 2021, we had the outbreak of cholera in most of our communities, across the country even, and particularly in FCT, we had deaths, especially of women and children. And at that time, there was a quick action by the then Honorable Minister to intervene in those communities in the provision of safe drinking water. And we made provisions of the hand pump water supply scheme and also the solar powered water schemes. And that is not just enough, providing the facilities. We had to start engaging our citizens in the sensitization program, in kind of awareness program. Because some of the communities, even when you provide the safe drinking water facility, they will still prefer to go to the streams and say their forefathers drank from the stream for the last 100, 200 years and nothing happened. And we need to now sensitize them and educate them that, look, 50 years ago, 100 years ago, are not the same as now.
Yes.
Look at the pollution, look at the population, and look at your river.
Yes.
Very highly polluted. And we now have to do some statistics with them. We now call them and say, okay, in the last 3 months, who and who were sick in your family? They say, so. What was the diagnosis? Did you go to hospital, clinics, health center? They said yes. Okay. And you found out that 95% of the illnesses were water sanitation related.
Related.
Okay. So, with this sensitization and the awareness you put out to the general public, I believe that a lot of these people don't know where the sources of this water comes from. So maybe if you can enlighten them out there where the sources of water we have in Nigeria comes from, I think that should help us.
Yeah, thank you very much. Nigeria, we are really blessed with abundant water resources. First of all, we have the surface water resources, which in some cities is harnessed and treated because you can't just drink it like that. It has to go through treatment processes. This happens in the urban centers. And that's why you have the water corporations, the water boards, and they have the water works where the water is treated, highly expensive, but it's subsidized. For example, in the Federal Capital Territory, when in the past, before 2015, we had two major treatment plants that treat water at the rate of 5,000 cubic meter per hour, two treatment plants, one and two. And then just at the tail end of the tenure of the past President Goodluck Jonathan, two other treatment plants were commissioned by Water Board. And those two, number 3 and 4, had capacity of treating water at 10,000 meter cube per hour, each of them. But however, even the challenge right now is when this water is treated, the conveyance mechanism, those trunk main lines are not really in place to extend to those areas that need the water. So they have to now produce the water at a lesser capacity, probably at say 50, 60% capacity. Because when you produce water, where will you take it to? However, currently there is a project going on called the Greater Abuja Water Supply Project by the FCT administration. So when that project is completed, there's going to be a boost in terms of water supply in the cities and even in our rural communities. But of course, you realize that we have interiors, we have remote locations, especially our rural communities, where they are not served by pipe-borne water, and even some satellite towns and parts of the city. So we rely on groundwater. And groundwater is naturally filtered water resource that you can harness, you can exploit. As far as there is no human influence in terms of the safety of that water, cause pollution. So through drilling of boreholes, hand dug wells, we tap that groundwater, and then it also goes it also undergoes water quality analysis to ensure that it is safe, because through the dissolution of the minerals and rocks within which the water is contained, you also have some of those minerals in the water. So that's why it's always advised that you test the quality of the water based on the Nigerian standards for drinking water quality and also the World Health Organization guidelines for drinking water quality. Once the quality fits these guidelines, then it's recommended for drinking. If there are issues due to human influence or due to dumping of refuse or is close to soakaway and you discover presence of say E. coli like that, then you now recommend this is not good for consumption. Either it has to be treated or it has to be even condemned at all. So that is the situation right now.
Now, quickly, I've had this concern for a very long time. It would seem like um, almost every house is drilling borehole. And earlier on, you were telling us about the beauty in groundwater, how purified and how some of those mineral components that already are in the ground find their way into the water and why it's good. But are we not over drilling this borehole? Are we doing too much?
Thank you very much. We had in 2010, there was a code of practice for water well drilling, which is domiciled in Standard Organization of Nigeria. That document is a guideline standards for drilling of boreholes.
Okay.
But it's one thing to have the guidelines and standards, and it's another thing to do the actual. And we've had cases of proliferation of boreholes, even in the Federal Capital Territory. I will recall in the year 2012, under the FCT water board. And some people were not willing to pay their water bills from the pipe-borne water they received. So there was an inventory of the houses that claimed to have boreholes and they didn't want to pay the water bills. Houses already served with pipe-borne water. And at the end of it, we had about 2,505 houses that had drilled boreholes. And this is between the city and the satellite town that are already served by pipe-borne water. So you can imagine one of those that were not even served by pipe-borne water. So there's a lot of proliferation. However, the idea is to do it to standards without damaging the environment and without overexploiting the aquifer, because it's a water-bearing zone. You are taking from the common pool. We don't want to get to a situation where we have an overdraft. With every cycle of rainfall, the groundwater is being recharged. But if we are extracting more than is being recharged, it will lead to what we call overdraft. It's just like a bank account, and you are withdrawing more than you are depositing. So we get to a stage where you have an overdraft. And that when you get to that stage, it might lead to what you call subsidence. The soils and rocks trying to naturally settle to reach an equilibrium, and you have what you call subsidence, not earthquakes. Some people thought that drilling of boreholes will lead to earthquakes. No, but it will lead to what we call subsidence as a result of differential settlement of the soils and rocks. So, and then also when you take too much, you might, you know, encourage the introduction of contaminants into the groundwater. So there are guidelines right now, even the FCT RWASA, the Council for Regulation of Mining and Engineering, Mining and Geoscientists in Nigeria, and private sector are now meeting since the last 4 or 5 weeks to bring up a model in which we regulate the drilling of boreholes and want to use FCT as a case study. What you have right now is you have some agents from the area councils. Once they see a drilling machine, they move to it and say you must pay 20,000, 25,000. And once you pay that, they move away. They don't care whether you've done the drilling to standards, meeting the specifications without injuring the environment, and ensure that once you finish the drilling, you take a sample of the water to the lab for water quality test to ensure that it conforms with the standards for drinking water. So that aspect is missing. And right now, with the Council for the Regulation of Mining and Engineering, COMEG, with Federal Ministry of Water Resources, Nigeria Integrated Water Resources Commission, the FCT, RWASA, we are putting heads together to see if we can start that in the FCT. I started in some states like Oyo State, Kwara State, regulation of drilling of boreholes. So we want to also do that. And this is, but before we start, that sensitization and awareness is key. We have to sensitize the communities, the people, to know that this is important. This is for our own good as citizens and for generations yet to come.
Okay, thank you, sir. Sensitizing the public out there is very important.
Especially in this year 2024.
We need to change. We need to change our attitudes. So, what about advice before we let you go?
Thank you very much. My advice to my fellow citizens is we must take ownership. We must be in control of what we do. It's not just the government alone. Every citizen is also a stakeholder, is also part of the government. And nobody is going to do it for us. Nigerians, we must do it for ourselves. We must ensure provision of safe drinking water and sanitation. Ensure that every household has a toilet. We stop open defecation. This will keep all diseases away. We must take ownership of ourselves. So I encourage all the citizens, not just the Federal Capital Territory, but Nigeria as a whole, that we should take ownership of our water and sanitation services in our households, in our communities, in our states, and in the country. Thank you.
Thank you so much, sir. Thank you for coming on the program. Well, we've been speaking to Dr. Mohammed DAN-HASSAN. He is the Executive Director of Rural Water Supply and Sanitation Agency, and we've been looking at the challenges of water supply in Nigeria as a whole. And you know, it is important. It's not just important, it is a must for us to have good water for good health. And this is 2024. We need to change our attitudes towards, you know, just making the environment unhealthy for everybody. We're going to short break and when we come back,